Dr. Imrana Pasha is on an urgent assignment. She works at the Al Khan University Hospital in Karachi, and she's leading a program in Thatta to save mothers who can't deliver normally and who fail to reach the hospital in time to get emergency care.
One of the things that we saw is that there's a lot of programming around this concept of the 3 delays. Most women who die in pregnancy or after childbirth die during the time of labor or immediately after, because that is clearly the most dangerous period for the mother, because a lot of things can happen which are unexpected. The woman needs to be able to get care very fast if things start to unravel during the delivery. And that is where women who are delivering in homes or women who are delivering in facilities which cannot provide this type of care really suffer.
Experts say that what kills women are the 3 delays. Firstly, there's the woman's delay in recognizing that she won't be able to deliver naturally and that she needs to go to a hospital. The second delay is the time that she loses in traveling there. And the third delay is the hospital's delay in treatment once she arrives. In an effort to stop these so-called 3 delays from happening, the project is trying to prepare the community for emergencies.
We've been working in about 990 villages across Thatta, training both the traditional birth attendants and other people who attend deliveries, but also the family members about what constitutes the danger signs of delivery, using a curriculum which is known worldwide and well accepted, called the Home-Based Life-Saving Skills Curriculum.
Using pictures to tell the stories of the unfortunate women who haven't made it to the hospital in time, they hope to leave the villagers convinced of the need to learn from these mistakes, but the villagers are often unwilling to let go of their beliefs.
मेरी एक औरत थी, वो उसको जो ना वो 18वां बच्चा था, तो वो कह रही थी कि भाई ये जो मेरी 18वीं प्रेगनेंसी है, मेरी सास कह रही है कि भाई मैंने जो बच्चे पैदा किए हैं 17-18 जो बच्चे पैदा किए, हम लोगों ने यहीं पर ही बच्चे पैदा किए। हम लोगों के जो बड़े थे वो ना अस्पताल में दिखाते थे ना बाहर दिखाते थे। हमारी बहू या बेटियों को हम लोग तो नहीं छोड़ सकते, पर हम लोगों ने उसको ये कहा कि भाई आजकल का दौर जो है ना वो बहुत अलग है। हम लोग उसको वो एग्जांपल्स देकर ये कहते हैं कि भाई पहले जो ज़माने में प्याज की रोटी और वो खाते थे, आजकल जो है ना वो मक्खन और मानी और रोटी में भी ताकत नहीं है, तो फिर हम इसको कैसे कंपेयर कर सकते हैं?
For example, they say when there is lunar eclipse and the woman is stitching a button on her husband's shirt, the baby will be born with a torn lip. Then they say during childbirth, if you give pure ghee, melted butter to the woman to drink, the baby becomes slippery and it will slip out quite. There are many, many, many myths like that. It's very difficult to change thinking of people.
We do not try and challenge their beliefs unless they are unless they are specifically harmful to the woman or her child. We want them to understand that if a woman has been laboring for more than 24 hours, they should take them to the hospital.
And at least one man who attended the training was armed with enough information to save a mother's life.
अब लोगों की मीटिंग हुई, हमने उधर था मौजूद था, सुना कि भाई जब बच्चा पैदा नहीं हो रहा है तो 12 घंटे के बाद कि उसको अच्छे अस्पताल में ले गए। हमारा सा ये हादसा हुआ था कि वो जब दाई अपने वश बहुत लगाया, बहुत कुछ किया, मगर टाइम ओवर हो रहा था, तब हम उधर पहुंचा, उनको बोला कि भाई ऐसा नहीं करो, इसको अच्छी अस्पताल लेके जाओ। अस्पताल गया, बच्चा तो नहीं बच सका मगर माँ जिंदा था।
One of the things that we're trying to impart to the doctors is, if a dai brings a woman, please don't abuse the dai. Don't say, oh, what have you done? You've ruined this case, which makes them very reluctant to go to the hospital, obviously, to the detriment of the patient.
In India, projects are experimenting with paying TBAs to bring patients into hospitals.
I don't think that the country is ready, either us or India, for a wholesale move from home delivery to facility delivery. We just don't have enough facilities, we don't have enough doctors. The 75% of women who are currently delivering at home, if they turned up at the hospital in the next 1 year, there wouldn't be resources to take care of them. And a normal delivery can be conducted quite safely by a dai in the home if she just maintains a certain standard of cleanliness. But the second thing is that the recognition and bringing to the hospital is a more important thing. But paying people to do things like that just does not make a long-term difference, because they are motivated to do it by the money, not because they think that that is what they should be doing.
In an effort to combat the third delay, which is the delay that occurs at hospitals, the team has been training doctors to be more equipped for emergencies.
In medicine, things are not constant, they keep changing. Doctors need to be updated. We're using a lot of role play, you can teach something by just reading or projecting some slides, but really the best way of learning is when you actually make people do something.
But there's only so much that the doctors can do themselves without the support of facilities.
Just like we have ghost schools in Pakistan, we have ghost hospitals where there's just a rundown building, or it's just in name only. So people go there thinking they're going to get something, but really there's not much to be done. Even if you make a doctor sit there, if I'm not going to have the drugs, if I'm not going to have an anesthetist or a blood bank or basic life-saving equipment, I'm useless. It's just like going to a war and you don't have a gun, you don't have a sword, you have nothing, you're just going there to die, to get killed.
In much of the developed world, they've virtually eliminated maternal deaths from causes such as bleeding, infection, prolonged labor, and high blood pressure.
They have institutionalized childbirth, which is that every childbirth occurs in a hospital. But they have many more resources than us, but also they have a lot fewer people than us. I think one large thing that defeats us many times is how large our population is and how fast it's growing. There's no magic bullet. There's nothing that's going to be, that's going to take care of everything. So as I said, it has to be a multi-pronged approach, which is what we're doing here in Tata. We are educating the community, we're educating the midwives or traditional birth attendants, and we're educating the doctors. And we're trying to get together a system whereby they all work with each other for the benefit of the women and children. And communities want to do that, doctors want to do that. Dais want their deliveries that they're doing to turn out well. And if you show them that there is something that they can do using whatever they have currently to do that, then I think that people are smart. They may not be educated, but they're smart. They know what's in their own best interest. And if given an opportunity, they'll choose that path.